Our story is a humble story, but it is one of 130,000 stories of people, common patients across the country like us, who got a letter from their state health department that said, "Dear Sir or Madam, you've been exposed potentially to hepatitis C, hepatitis B, or HIV because of a procedure in your doctor's office. You need to go and be tested for those diseases." So when you get a letter like that, it changes your world. So what went wrong? How did this happen? How could this have happened to so many Nebraskans? Well, what we found was that it was an improper port flush procedure. The index case came to the clinic in 2000. The index case, as a young person, lived on the East Coast and contracted hepatitis C genotype 3A through illicit drug use as a young person. Then as an older adult, moved to Fremont, developed cancer, came to the cancer clinic, brought hepatitis C genotype 3A with him. What we found with the port flush procedure was that the nurse would draw blood from our ports, then would put that blood in lab collection vials. She would switch off the needle, but use that same syringe to access a 500 cc saline bag. When she, drew the blood from this index case, then his blood contaminated that saline bag, and then that's how all of us contracted hepatitis C genotype 3A, the same genotype, from that one index case. So in the morning they would start out with a new bag of this saline. Actually it was a 1,000 cc saline bag. In the morning it was new, fresh, clean, but by afternoon patients reported that it was cloudy pink with bits of sediment in it. What would happen is that, so index case came, let's say, on a Monday at 8 o'clock in the morning, and from there, let's say patients A, B, and C contracted hepatitis C from him that day, but the next week perhaps patient A came on a Tuesday, and patient B came on a Wednesday, and patient C came on a Thursday. That's how it became so widespread. And in the epidemiological studies that the CDC did, they found that at one point, 100% of the patients who came in the month of December 2001 contracted hepatitis C in that way. So at least 6 patients came to the clinic with cancer, asking, hoping, praying that they would be cured of their cancer, but came away with a different deadly disease that did claim their lives. So that it's just incredible to think that you could be battling cancer, but yet something else that you contracted, a different disease that you contracted in the course of medical care, actually claimed their lives. So although that's a horrific story and seems absolutely incredible, it's hard to believe that this happens in the United States. It's not an isolated incident.